Good afternoon. I'm David Sweat, Deputy Director, Shelby County Health Department, and welcome to today and the last regularly scheduled press briefing of the City of Memphis Shelby County Joint COVID Task Force here on June 24th. Straight into the numbers, we've had 99,626 cases of COVID-19 disease reported in Shelby County during the pandemic. Had 7,470 cases up in Tipton County, Tennessee. Had 5,210 cases from Fayette County in Tennessee. 5,786 reported cases from Crittenden County in Arkansas. And 22,329 cases reported so far from DeSoto County in Mississippi. In terms of our vaccine campaign, in the last analysis, we had yesterday 383,015 people had received at least one dose, and more than 306,000, and I believe that's probably up to over 309,000, have been fully vaccinated as of today. We're averaging about 1,126 people per day coming out to get their vaccination against COVID, and we would like to encourage every one of you who have not yet taken advantage of that opportunity to please come and do so. We still have widespread availability of the vaccine. And our average number of cases being reported per day over the last 7 days has now dropped to 23 cases per day. That's excellent. But we do have some reasons to still be concerned. The pandemic is certainly not over. We do have over 300 active cases right now, and 29%, 92 of those active cases, are pediatric cases. So our children right now is where the virus is spreading most rapidly and most easily. And we know that our children remain some of the most vulnerable due to lack of vaccination and lack of prior disease. So they're the most susceptible to the virus right now. And we have in the community the Delta variant that is spreading. We've had 18 confirmed cases of the Delta variant, and we have over 119 people, or we have 119 people that are part of those investigations right now, either as cases or contacts to cases. And as I said, 29% of our currently active cases are pediatric cases. We do have about 18%, 17.9% of our eligible children, the 12 to 17-year-olds, have been vaccinated, but there are many eligible children in Shelby County who could still come out and be vaccinated, and we certainly want parents to understand that that is an opportunity and that the virus is spreading most quickly among children right now in Shelby County. As far as the rest of the Delta variant investigations, prior to June 9th, we had 2 clusters of Delta variant, and both of those clusters started with someone who had travel history to India. Since June 9th, we've picked up 16 more clusters, including 4 last Saturday, that have no international travel. Some do have domestic travel connections to states like Texas and California, but most of the infections occurred locally here in the Mid-South. So we do know that the Delta variant is here. It's highly transmissible, and it's something that we should take seriously. Even though our overall numbers are going down, we don't want to see a resurgence this summer. So that's the urgency of our call to action right now, is if you have not yet been vaccinated, there is a very contagious version of COVID in the community, and you still have time to come and get vaccinated. And for more information about how to do that and progress on the campaign, I'm turning over to Chief Doug McGowan.
Thank you, David. I'll talk today a little bit about the campaign, then talk about vaccinations and our vaccination operations, and then just like to wrap up with some amplification of what David said about the state of the pandemic. So our campaign to drive people to get vaccinated continues, and we will continue that in earnest through the end of July is our plan right now. We have a multi-pronged approach, as you know. We have the opportunity through our healthcare navigators to get homeless and homebound people. We are going to where they are and encouraging them to get vaccinated and then providing that vaccination on the spot. You can also register for one of those if you know someone who's homebound, but we've done more than 2,000 individuals that way. We have our best shot team going door to door. So far, they have visited more than 8,000 homes and had conversations with individuals in those homes. And those are in the areas of the city where we have the lowest uptake. We also have our call center that is doing a campaign via telephone, and they've called more than 8,000 individuals by telephone. They will continue that work again through the end of July. We also have a street team, and that street team is going business to business, event to event. They've set up informational tables, trying to share information with people at festivals, places like super low grocery stores. Also, we had some events on Juneteenth, and our street team was there. They're also out in the evenings at some of the nightclubs and some of the shopping malls. So you should see our street teams out there sharing information with individuals, trying to encourage them to get over their vaccine hesitancy and to get out and take vaccines. So on the vaccine front, as David mentioned, we are making progress still. We've got 690,000 vaccines already delivered, and David is right. More than 309,000 people have been fully vaccinated, and just under 390,000 people have received at least one vaccine. So about 41% of our population has at least one shot, and 33%, 1/3, are fully vaccinated. So that's good progress, still not where we want to be. We continue to provide public drive-through vaccinations this week at 3 locations. That's at the Pipkin Building, Germantown, and Whitehaven. At the end of this week, Germantown and Whitehaven locations will be closed, and we'll have one public drive-through site available at the Pipkin Building, and that will stay that way through the end of July. That's based on the demand that we see for people who want to drive through and get a vaccination. The tide has shifted, and many more people are getting vaccinated at community clinics, hospitals, pharmacies, and we still have a significant amount of availability. It's not hard to get a vaccine if you want to get one. Further, we still have the rides to vaccine through 901 Ride 901. So if you believe that you're transportation challenged, just call that number. They'll come and pick you up, and they will deliver you to a vaccine site, and they will take you back home. And the last thing I'll say, in addition to the drive-through sites, in addition to those private providers who are giving vaccines, we have more than 31 events scheduled with community partners between now and the end of July, where our healthcare navigators, our vaccine machine, and other partners are working with churches, organizations, and events to host vaccinations during the course of their event. So 31 of those pop-ups scheduled between now and the end of July. We still have a little room, so if your organization would like one, please reach out and let us know. So what I'd like to say, to amplify what David said, is that we are not out of this yet. We are bringing this forum to a close because the numbers are moving in the right direction. The criteria by which we would call another press conference is if something substantially changed. If the positivity rate started to go back up, if the transmission rate went back up, if the case rate started to go up substantially, we would call and announce a press conference to share with you information. Assuming things continue to go in the right direction, we see no need to do that. We'll continue to put information out through normal channels on our website and other press announcements. But we are really not out of this yet. As David mentioned, the Delta variant is of concern. There are several other things that are of concern to me with the Joint Task Force, and that is this. Missouri is immediately adjacent to us, and they have the highest transmission rate, the highest positivity rate in the nation. And you all know that they're just across the river from us. There are other states that are very close to us that still have a positive transmission rate, a positive replication rate of the virus, meaning that for every one case, there's more than one case being produced. Folks just across the river from us, so we have to pay attention to what's happening there. We also have to pay attention because in the surrounding counties in our metro area, their vaccination rate is below 30%. So that drags down our overall metro population vaccination rate. And as you know, we are all one metro and we interact with each other. So the counties around us are below 30%, and that's what puts more people at risk. They all take their services here in the city of Memphis and Shelby County, and exacerbating that is that their medical services are largely provided in Memphis and Shelby County. Now, it's not due to COVID, but our ICU rate of utilization is up in the 90% range. That means that we have a very high use of our ICU rooms, and that we don't have a lot of room to accommodate very sick people with COVID. You'll recall back in the winter time, we had hundreds and hundreds of people in the hospital, and our ICUs were very full. Well, our ICUs remain full, just not with people with COVID. The summertime is a time, unfortunately, when people suffer trauma, when people get injured and ill, and they need to be hospitalized. So when you multiply those together, we really can ill afford to have a big surge in sick people in the hospital because of COVID. It will really strain our system. And so my recommendation is what David said. Vaccination is our best course to prevent that from happening. And also, I will say, as a person, I am paying attention to what's happening. I personally will, for the next few weeks while these numbers come down, if I don't know the vaccination status of people I'm around, whether indoors or outdoors, I will continue to wear my mask. I understand what the CDC recommendation is. I understand the health directive here, and I know what the rules are. But what I just described to you, to make sure that we're not putting people at risk, I personally, if I don't know the vaccination rate or the vaccination status of people around me, whether indoors or outdoors, will continue to wear my mask until we are sure that these numbers continue to go down. So I'm not changing any directive or making any directions. I'm just telling you that that concerns me and that those factors are something that we should pay attention to. So with that, I'll stop and take any questions.
Corn Kennedy, Commercial Appeal.
Hi, thank you both for making time to talk to us today. Both of you mentioned that, the numbers are trending in the right direction, but we are not out of the woods. Where are we right now in the scope of the pandemic, and how close are we to being out of the woods?
Well, that's a question for David to answer. He's the epidemiologist, and he can probably give us his best assessment of that.
So thank you for the question. And as far as where are we? Well, I think Doug summed it up pretty well. Here in Shelby County proper, we're doing okay. We're headed in the right direction, but we're surrounded by areas that are not okay, right? And so what we are concerned about, or what we are watching there, it's not just about the cases, it's also about the susceptible population. What population remains vulnerable and susceptible to infection? Where is the next surge going to happen? Those are the questions that are on our minds, because we've been through several surges. We had the original surge that when the virus arrived, then we had a summer surge last year that brought us up to 300 plus cases a day, and that was really kicked off on Memorial Day weekend and went through past July 4th and didn't really subside until the end of August. And then we had a fall surge into the winter that was much bigger. We had our highest day of new cases, I believe, around January 3rd, where we were getting 925 cases reported or diagnosed that day. So that was a huge surge. And then we came out of that. And then we headed into, we were going in the right direction until March, and then the Alpha variant arrived. So we had a surge associated with Alpha variant cases in throughout the month of March, April, May, and then it began to subside. And right now where we are is we're headed in the right direction, trending well. Our T is below is 0.78 or 0.75. And our average number of cases diagnosed per day is only 23. So that's all good. It's all good. We've only got 313 cases actively diagnosed in the last 14 days. That's great. But we have this new variant, the Delta variant. And that variant is 50% more transmissible than the Alpha variant was. So we do expect that this summer could be rough for those people who are not vaccinated, and also those folks who have not had prior infection. So what I would say is, where are we? We've probably got 350,000 people, with half of them being children, that remain completely naive to the virus, susceptible. So where we are right now is that if you're vaccinated, you're doing great. If you've had it, you have a level of immunity in your system still, and the Delta variant, if you encounter it, is less likely to make you sick or less likely to make you very sick, because you have that immune memory. But for those 300 to 350,000 people, half of them children who have no immunity to the virus, if you come in contact with the Delta variant, you're virtually guaranteed to get it. It's so contagious. And so what we're going to have is a summer of different experiences, and the difference on what your experience is going to be is completely about vaccination. If you're vaccinated, you're going to probably have a good summer. If you're unvaccinated, you may get very sick.
And as a follow-up, you mentioned the Delta variant cases, some of them being connected to travel, others not. What does that indicate to you about how the virus is spreading in Shelby County?
It's not just in Shelby County, it's all over America. And if you watch the national news, you'll hear White House spokespersons, FDA spokespersons, CDC director, and others are all talking about the Delta variant. Well, what's the concern? The concern is it's spreading like wildfire throughout the country in populations that are not vaccinated, and that is the big concern. Right now, as of this moment, as the director of the CDC mentioned, and as we have mentioned previously here, if you die at this point from COVID, it's because you're not vaccinated largely. Overwhelmingly, the cases that occur are unvaccinated people, and therefore the hospitalizations that occur happen among unvaccinated people, and the severe disease and deaths are happening among unvaccinated people. So we really have a tale of two Americas right now: a vaccinated America that is not getting the disease. Even if they get it, it's a mild version, and they're not dying. And then we have unvaccinated America, where all the suffering is occurring. And so what we really are trying to encourage folks to do is get in the vaccinated pool, get on that side of the line, because that's going to make, it's going to make your summer better, but it's also going to reduce your risk of severe disease, reduce your risk of winding up in the hospital on a ventilator in the ICU, reduce your risk of dying. And we've had too many people die already. We've had 1,685 Shelby County residents die from COVID. And that's 1,685 times families have been disrupted and people have lost loved ones. And all of that is preventable at this point. So if you're not vaccinated, we really, really encourage you to come out and get the shot.
Chris Luther, WMC.
Hello, everyone. Can you hear me?
Yes.
So some, local epidemiologists say that Memphis is in a very unique danger zone, one of the largest cities to be surrounded on all sides by states, and actually in Tennessee, a state that is lowly vaccinated. The vaccination rates in Arkansas, Mississippi, and Tennessee are all very low. As you were saying, our ICU occupancy is still around 90%. So is there, and I guess, are you guys preparing the community for potentially some rough waters here this summer if there is another surge with the Delta variant in terms of, and we've been talking about this for over a year, but in terms of occupancy in hospitals and overwhelming our hospital system if that large unvaccinated population were to get a lot of this Delta variant that's going around?
So thank you for the question, and yes, we are concerned. Yes, we are working with the hospitals for planning, but Chief McGowan is actually in a lot of those conversations, and so I'm going to invite him back to the podium to answer.
Well, thanks, Chris. You said it for me. That's why I'm concerned. We are planning for the worst, but hoping for the best. So we haven't stopped our efforts here to make sure that we are planning. There are some things that are different, though. When our ICUs were stressed to the limit previously in the middle of the pandemic, remember that everybody else in the country was similarly stressed. So there really was no place to ask for help, to recruit people from, to ask others to come and help us, because our capacity is limited by the number of staff that we have. There is ability to expand capacity physically, but it's always the staffing issue. The good news is that there are places in the country where the pandemic is at very, very low levels, where their hospital systems are not strained. And so logic would tell you that there is likely a pool of individuals there that we could call on. That's what we are working on to make sure that we have the capacity to do. We have made the state aware of that. I've spoken with the hospital CEOs, and we are on a regular drumbeat of coordination. We also are entering the summer, and as I said, the height of summer when unfortunately there are far too many injuries and traumas to make sure that we can care for patients in that setting. So this is not a crisis yet. It's just something that is of concern and something we have to pay attention to and continue to work on. And that's exactly what we will do, just as we did at the height of the pandemic when we had significantly high census of folks with COVID, both in the acute setting and the ICU setting. We came together as a community, irrespective of what hospital system you were with, what government agency you were with. We all worked together as one, and we will do that again. I offer that information only for perspective that, as you said, we are not out of this because of some of those factors, a low vaccination rate in the areas around us, and the fact that we still have some pressure on our hospital systems. And so it's worth it for us to pay attention and to plan ahead to make sure we can handle anything that comes at us. Do you have a follow-up, Chris?
I guess just one quick follow-up. Considering obviously we're keeping a close eye on the Delta variant, do you think this is the right time to suspend these now weekly COVID-19 task force meetings?
Well, let me say it clearly. So the task force meetings continue. So we are continuing the meetings with all of the principals. This briefing is the thing that will conclude here today. But that doesn't mean that we'll stop sharing information with you. It's just we believe, again, planning for the worst and hoping for the best. If the trends continue, there's not much new information to share. I'm not sure how many times I can come on here and implore people to get vaccinated. People who simply don't want to probably won't. I'm trying to encourage people who are on the fence to give them all the information. And so we think that today is a good time to bring this to a close, but that doesn't mean the work of the task force is concluded.
Brad Broders, Local 24.
Hello, everyone. Long time. Question for David. I doing a little story today about I know this warning came out a couple weeks ago about the concerns about the respiratory illness RSV in the South. Apparently, it's been pretty high for summer standards. Any kind from the health department's perspective, anything you can add about how this might play into the children with active COVID cases? Any advice to parents with RSV?
Right. Well, if I could expand it from RSV and other respiratory pathogens, one of the things that the COVID lockdowns, the virtual school, the work from home, all of those social distancing measures that we took for the COVID epidemic, they not only disrupted or slowed down the spread of the COVID, the virus that causes COVID, but they also disrupted the transmission of the common cold, of RSV, of influenza and parainfluenza, and all the other respiratory pathogens. So one of the things that that we are very a little bit concerned about is that as the mask mandates have gone away, as school is out, as businesses have reopened, and other sort of measures have relaxed, and people began to interact with each other more socially and in person once again and unmasked, that those respiratory viruses that have been held at bay are going to come roaring back into prominence. And we're seeing that right now with RSV, particularly in the South. And it's not the right time of year for RSV. I mean, RSV season really doesn't hit us normally until around September and heading into the fall. And so for us to have a large increase in RSV cases across the nation right now is a warning sign that we could be in for a rough rest of the year with these respiratory pathogens, that the COVID restrictions held at bay. When you take away those restrictions, those pathogens have a lot of susceptible hosts who have not been recently exposed that can trigger transmission. And we did not even have a flu epidemic last year. It was virtually non-existent. There were still a few people that had the flu, but really the epidemic flu, we didn't see that, but we had COVID. This year, I would not be surprised at all if we have a bad flu season. So once the flu shots start to become available, in addition to your COVID vaccine, I would say please go get a flu shot.
Thanks a lot, and that's point of personal privilege. Thanks for all the time you've been giving us all these months, and it's been a roller coaster, but appreciate you always keeping us informed. Thanks a lot.
Thanks, Brad.
Hannah Grabenstein, MLK 50.
Good afternoon. A couple questions for Doug about the vaccination program. I hear you standing up there and saying there's not much more you can do to implore people to get vaccinated. I totally hear that. I'm wondering what the plan is after July 31st when Pipkin is planned to be closed. So there'll still be community vaccination sites, or or community pop-ups? Will the city be involved in the vaccination effort anymore?
Yes, thank you for that, Hannah, and I apologize for not mentioning that. So there is, based on the projected demand, and as I've said from the beginning, we will always pivot to meet the demand that we see. So will not stop at July 31st. That's just when we believe, based on the demand, that the demand for drive-through vaccinations will essentially outweigh the efficacy of having one. But after that date, for the months of August and September, is what we have planned right now. We will have a community clinic where you can park and walk in and get vaccinated. Again, a publicly accessible community clinic. And we have at least one of those identified right now. If there seems to be a need for more than one, then we'll identify that site as well. So yes, you'll continue to be able to have a publicly provided vaccine from now and through the end of September. And then we'll continue that and extend that if we need to. If we see the demand go up, if we get different direction from the CDC or the state, then certainly we'll change. We're not eliminating our capacity to do that at all. So, but it's a good question. Again, those sites coming down today at Germantown and Whitehaven, then we'll have the Pipkin building all of July, and then we'll have a community clinic. Today, the likely location is going to be over on Avery Avenue, just up the street from Pipkin at our Office of Emergency Management, and that's where we have been giving some public vaccines as well.
And then as these drive-through sites wind down, I think of Pipkin as sort of like the anchor site. I'm just wondering, can you talk a little bit about how the community vaccination program has gone? Did you feel it was successful? Do you think that you had vaccination sites in the right places? Are there any differences that you think, if you, God forbid, had to do this again, you might do differently?
Well, that's a really good question, and we will certainly do an after action report where we will talk with everybody about those lessons learned. I do believe that given the circumstances that we were presented with this pandemic, the rate at which it came on, as David mentioned, the pace at which we needed to give vaccines and the volume that was required, that we put them in the places where we believe we could reach the most people. And then the areas where it was more difficult to reach mass volumes of people, that we did a good job of having pop-up community events in places that were convenient for people to be reached, and through their trusted partnerships, and largely in Memphis and Shelby County, that was through the churches. So I am not looking in the rearview mirror with any regrets about how we've done that. The only regret I have is that, when we had the federally assisted vaccination effort that would have given us fully, 3,000 additional vaccines a day over at the Pipkin building, that we didn't max that out. I still had significant capacity that we didn't use, and it's unfortunate that demand fell off a little bit, but I believe we reached everybody who wanted to have a vaccine, was able to get one in a timely fashion and conveniently to them. I believe that we've unearthed almost every strategy that we can think of to get people who were undecided to get a vaccine. And then we recognize that there are a group of individuals who just will not get a vaccine under any circumstance. So given all of that, I feel very good about where we are as a community. My only hope is that we had a bit higher uptake of the vaccine.
We are out of time, and I believe Chief McGowan has some final words for us.
Sure. So clearly, our message here today is that, as it has been, we would appreciate folks taking advantage of the vaccines, because that is the key to driving this pandemic to the ground. David, I think I'm right on the RSV, which is a really good and interesting question. A mask is equally protective of that as it is COVID, right? So if you're a parent, and there's a vaccine for RSV. So if you're interested in that, I'm sure you can call the Shelby County Health Department to find out about the RSV vaccine. But if you're a parent of small children, you're worried about RSV and COVID because your child's too young to be vaccinated, then a mask is a really good idea. So just something I thought of there as we were talking about that. But we will give you information as we have it if it changes. I would like to thank the press who comes to this religiously each and every week, and when we had it bi-weekly, and thank you for helping to get the word out about this important work, about the status of the pandemic. I think y'all have done a really good job of keeping the public informed, and we've tried to give you good information. But the information we give you is only possible when we have really smart people and good partners to deliver that. So David, would you mind just coming up very quickly? It's unfortunate for our community, but if you don't know, David Sweat, this is his last act as the Deputy Director of the Shelby County Health Department. David is taking an opportunity in Mecklenburg County in North Carolina, and they are going to be blessed to have his talents there. It is our loss and their gain. And what I would like to say to David, I'm not used to the camera, but I'd like to shake your hand. Absolutely. And I'd like to say thank you on behalf of the 650,000 Memphians, the 937,166 people that call Shelby County home, and the 1.4 million people that live in this region. We are in a much better place because of having David Sweat on our team and helping to guide us from an epidemiological standpoint. So David, thank you so much for your stalwart support, and we wish you collectively the best of luck in your future endeavors. So thank you again so much.
Thank you, I appreciate that.
Yeah. All right. So again, thank you, everybody. Stay tuned. If we need to have another press conference, we will do so. And until then, I wish everybody a good weekend and stay safe.
Thanks, everyone.